Hello, I'm Spencer Collins, and my role was being a physician. Physicians have a very, very important role in combating many pandemics, and it is also very noticeable how much they did in this most recent pandemic. So the main role of a physician in the healthcare system is to be the front line. They help diagnose patients by either physical examinations or even with medical history of the patient's family. Whether they are in a hospital, private practice, government setting, offices, and more, they have a huge role in many patients on the individual level. In a hospital or emergency room, patients are assisted from the scene all the way until they are discharged, and then they'll have to check back up with their primary care physicians. The primary role of a doctor is to support and treat their patients in various ways. They go through extensive schooling so that they understand how to do various things to help patients. Many doctors work together to improve the patient's symptoms. They work together by giving each other advice, giving each other ideas, referring them to other specialties, possibly getting the patient physical therapy if needed, and many others. The way I imagine the role of a physician is the bridge between the public and the complicated medical system. And they advocate for their patients in a non-biased, trustworthy, and effective way. Life without physicians would be very, very hard. Everyone sees a physician and they help them get through some of the lowest points of their lives. And physicians work with the population on more of a micro scale with the interaction with individual patients. For COVID-19, doctors have learned to test for the virus. They learn to administer vaccines and treat the harsher symptoms. They would sometimes need to intubate patients if they're having a very difficult time breathing, and this would help increase the chance of survival. We'll go more into this. And then they would also prescribe medicines such as steroids to handle the inflammation of the lungs, which will also increase the chance of survival. We're also going to go into this. And since COVID is such a convergent disease, it evolves very rapidly. So physicians have to be able to adapt to the new ways of treating patients. So overall, this role, I was able to take in account what patients would react to our protocols. I would make sure it's the best for them on the personal level.
Advocates for international agencies conduct research and provide information needed for governments and other key figures in order for them to act based on evidence and fact. We support governments as a partner for policy development and implementation. So this means working with civil society, media, the corporate sector, social movements, and the public to build a political environment for action. Governmental support leads to implementations at the state level, like creation of new policies for the general public to follow to prevent COVID-19. We are expected to propose conventions, agreements, and regulations, assist in developing public opinion, and promote international standards. So, international global advocacy is important in this model and in the real world because it ensures that the solutions to disease challenges are reached to people who need it the most. Being able to spread awareness and support to both the public and professional agencies is essential to combating COVID-19. So the more educated people are in prevention, the more likely for the disease to stop spreading. And if we keep doing this, our prevention will get better and better, and hopefully we can defeat COVID-19 altogether. So basically all of these responsibilities act as an effort to prevent and control all diseases, not just COVID-19. And our main vision is a world free of such diseases, and it is our job to promote health globally. One example of what we focus on as an international advocate is to consider human rights. So we highlight the importance of integrating human rights based on an approach in response to COVID-19. We provide key considerations in relation to addressing stigma and discrimination, preventing violence against women, support for vulnerable populations, quarantine and restrictive measures, and shortages of supplies and equipment. We also focus on human rights obligations with regards to global cooperation to address COVID-19.
As the community advocate for the Phoenix metro area, I think there were a lot of really useful insights that have to be considered when you're trying to approach something like COVID. I think the first thing is that the Phoenix metro area is incredibly diverse. There's a lot of people who live on reservations, there's a lot of people who were foreign born, and there's a lot of Hispanic populations, Black populations, and Asian populations scattered throughout the valley. And so information needs to be given in approachable ways to different people based on this knowledge. Past experiences with government institutions, such as through immigration, often shape the way that people view institutions in power, regardless of whether it's medical or otherwise. The other thing to note about the Phoenix Metro Valley up to this point is that vaccination campaigns have been kind of lackluster. Would point towards the Hispanic population being 16% less likely to be vaccinated in Arizona than the national average, and in white non-Hispanic populations, it's down 9% from the national average. It shows that people are even less likely to trust institutions in Arizona. And so we have to take into consideration cultural considerations, information available in different languages and at different reading levels, and really making an effort to reach into these different communities through community action. So speaking with people who run things like churches or other community leaders is an important way to go about it. I think that a surprising thing that's often not considered as fully as it should be is the lack of vaccination in white non-Hispanic populations. I think it's easy in some ways to come up with culturally tailored, relevant explanations when it comes to the Hispanic population in the Valley, for instance, where you can say, well, we can clearly see that there's not enough Spanish language information getting out there, or we're not working with existing communities. But among the white non-Hispanic population in Arizona, cultural values have resulted in this intertwining of political affiliation and vaccination status. And often these populations don't have the same attachment to community or the same experience living in multi-generational households, which leads to this individualism becoming a driving force in decision-making. So part of being a community advocate also means advocating for these people. And part of marketing COVID response needs to try not to appear as directly from a larger power, but instead as part of this community action. And it should tie into community building efforts. Additionally, in this population and others, it's important to stress scientific explanations in the face of individualism, and the importance of education on the topic instead of referring to existing expertise.
All right, so I was not the evolutionary biologist, but our group member was unable to do it. So what I understood from it is the main role of the evolutionary biologist in the think tank regarding COVID-19 pandemic is to endorse lines of thinking related to the biological process of viruses and how evolutionarily we can attempt to avoid its increase in virulence through having a strong foundation of abilities of the virus. Evolutionary biology perspective is unique because it is the significance of mechanisms and impact of longevity of human health. Biological evolution occurs on a population level. This role focuses on viruses' ability to infect and continue to infect hosts in order to maintain its presence in the host population, which would be us. Human evolution is complex, and understanding the history of humans and our health offers a unique angle for maintaining the health. I was best equipped to provide our team with pointing out gaps in our current approaches. For example, many times genetic ability is taken into account, but not the evolutionary ability. I was able to provide our team with lines of thinking related to the virus's goal of maintaining its presence in our population. As we are trying to outsmart the virus is trying to outsmart us. This role offers an important perspective because it accounts for the bigger picture in literature and studies available on the disease. In this position, it was important to emphasize the key considerations of mutations within the virus and the broader implications of these fast-occurring mutations. We have seen the need for this already, with the reemergence of the new variants. Weaknesses that an evolutionary biologist could experience is pushback from the various sources or religious groups. Evolution and religion have a difficult relationship at the surface and are often dismissed or discredited by various religious groups and beliefs. As an evolution biologist, information from medical journals, scientific literature, and evolutionary research journals and other reputable journals are going to be utilized.
Yeah, so let's take a look at the population and the profile of the country, including the characteristics of its inhabitants. So, looking at the Phoenix Metro Valley, the Phoenix area, the population is 43.2% Hispanic, 41.14% white non-Hispanic, 6.89% black, 3.91% Asian, and between 1.8 to 2% Native American. Some other things that are important to note is that almost 10% of Arizonans only speak Spanish, and that 500,000 people in Phoenix were born in Mexico. The Valley is a very urban place, which includes more than 5,000 homeless people. And there's plenty of access to hospitals all throughout the Valley, but this is often prohibitively expensive. Primary care providers are parents, but children are frequently sent to daycare and school as means of watching kids. While ideally parents are able to stay home and take care of children when they're sick and isolate with them, this is often not the case. Parents in the Valley and across the United States often have to go into work regardless of their sickness or children's sickness, and so oftentimes school still gets used as this place to put kids because there's nowhere else to go. As far as cultural considerations, religious institutions are notable for having community reach in various places throughout the Valley. The other thing, as briefly mentioned previously, is the work culture in the United States, which has resulted in a downplaying of COVID and other illnesses as people want to open back up again. As such, sicknesses in the United States aren't really treated to the same degree of severity as they might be in other places. The other cultural considerations vary significantly between the areas of the Valley, from Native American reservations to Hispanic communities, and each one has to be spoken to in its own way, and there needs to be considerations with what kind of language needs to be used and what methods of communication are most effective.
So what is this disease? COVID-19 is a strand of coronavirus and has spread worldwide since 2019, affecting people's respiratory systems. It originated in Wuhan, China, and is predicted that it was transferred to humans from bats, possibly by ingestion. This virulent disease is extremely contagious and can pose many long-term threats, such as organ failure, heart disease, diabetes, lung disease, pneumonia, and many more severe conditions. Most people can recover without intensive treatment from medical professionals, but many people who are at risk are the elderly or even other people with disorders such as diabetes, obesity, genetic disorders, autoimmune disorders, and more. Right now, there is insufficient evidence as to the exact length of the incubation period, but it is predicted that it ranges between 2 and 14 days after the exposure of the virus. Some symptoms may seem very vague, but they're very consistent in cases. These common symptoms include cough, fever, shortness of breath, fatigueness in the muscles, runny nose, sore throat, nausea, vomiting, headache, muscle aches, diarrhea, and loss of smell and taste. Some severe symptoms could be trouble breathing, myocarditis, which is inflammation of the heart, constant pain in the chest or pressure in the chest, confusion, inability to maintain sleep or stay awake, or even like pale skin or blue lips. Long-term symptoms include fatigueness, dizziness, shortness of breath, depression, anxiety, loss of smell or taste, organ damage, blood clots, and more listed above. Since this virus is so contagious, there are many pathways to access a new host. This can include being inhaled from one host to another when people are in close vicinities, exposed via mucus or droplets, and then these droplets will have the virus inside of it, or even handling surfaces that have been contaminated by touching it and then touching the face afterwards.
EUAs, or emergency use authorizations, issued by the FDA seem to be the best approach for treating patients with COVID-19. So there are several methods of treatment for severe and non-severe patients with COVID-19 that we recommend. For severe, we recommend the use of an antiviral drug, Veklury, that is approved for hospitalized pediatric patients 12 years and older. There also should be an availability of monoclonal antibodies that help our immune system attack and neutralize the virus. There's immune moderators, which help boost and suppress hyperactive immune systems or hyperinflammation, which is one of the symptoms of COVID-19. Patients in the ICU should have the availability of sedatives, which maintain sedation via IV fusion. There is also renal replacement therapy. So for patients that have damaged kidneys or kidneys not functioning normally, it's just a type of dialysis that filters and purifies blood. For non-severe COVID-19 patients, there is the availability of vaccines. The two that we recommend is Pfizer and Moderna, which are both 2-shot series and with 2 boosters. There's also Paxlovid, which is a prescription drug newly approved and created for COVID-19. So unlike ivermectin, which is only for animals, this is the best prescription drug to take. And then there's also OTC, over-the-counter products that can be used to treat COVID-19 symptoms like Tylenol, Advil, and cough medications that help suppress or relieve fevers. And if patients are at home and treating COVID-19, we always recommend hydration and rest. For costs of treatment, according to a University of Michigan analysis study, people with private insurance cost about $42,000 each hospitalization, $21,000 for people with Medicare. So we believe insurance companies should have waivers for COVID-19 care that cover most, if not all, bills. And waivers should not be stopped until infected numbers go down. So with waivers, the bills for patients with private insurance should be around $500 to $700. For Medicare, around $200 to $300. And the most that people should ever be billed should be around $3,000 to $4,000. Vaccines and COVID tests, they should be covered fully by the government. And also antibody tests over the counter should be reimbursed by Medicare and private insurances. Financial help to cover COVID-19 infected patients, there should be the availability of mortgage relief, homeless services, food stamps, meal programs, financial assistance for food, housing, and bills, and relief funds for nationally and globally. We believe this treatment plan would work best in preventing and fighting against COVID-19 spread nationally and globally. SARS-CoV-2 has not co-evolved with humans, which theoretically leaves it to be more difficult to become endemic, as seen with many RNA-based viruses. SARS-CoV-2 is also zoonotic. However, it doesn't mutate nearly as rapidly as influenza, as it doesn't have a segmented genome. These aspects of the virus can be taken advantage of and tracked. Thus far, evidence is showing a pattern of higher virulency with a lower R0 value and lower virulency with a higher R0 value. And the protocols taken ensure the primary goal, which is to reduce hospitalizations and deaths. With this, it should be expected to remain contagious. As COVID-19 is a viral disease, the ideal would be prophylactic treatment, which is why vaccines play an integral role. Viruses cannot reproduce on their own, therefore they cannot mutate without a host cell to allow them to duplicate. SARS-CoV-2 is no exception. As hospitalizations and deaths decrease, continuing to be diligent in vaccination will ensure the slowing of the viral spread, therefore limiting the ability of the virus to mutate. For individuals who have contraindications, an over-the-counter or prescribed drug may be used if they develop symptoms. Many cultures display hesitancy to modern medicine and biologics such as vaccines due to the history of medical fraud and abuse done to their family members in earlier generations. The best way to help ease their worries and increase the rate of vaccination in these communities is to communicate with them the global evidence, provide full transparency, have patience to answer their questions as they may arise, and be understanding. In the meantime, promoting smaller mitigation efforts can be made to help reduce the spread of SARS-CoV-2, such as mask wearing, washing hands frequently, and staying home if exposed or symptoms display. And some other considerations include availability of treatment supplies and availability of international immunizers and volunteers. So if we follow this plan, this protocol, it will most definitely stop the spread of COVID-19 and reduce our numbers.
A question posed to us was that since we are interested in tackling this from somewhat of a local standpoint in Arizona, are we taking special considerations for the many indigenous people that have large populations in Arizona?
This is a very interesting question, and I'm super glad that it got asked. There's a lot of really important notes that you have to make when dealing with indigenous groups in Arizona. The first thing is that the highest importance is always maintaining autonomy of reservation land, and that any priorities or any projects that are in the works must be in partnership with tribal leadership. It is never the place for us to step in and tell people living on reservation land how they should be dealing with COVID exactly, without hearing their concerns and working to address them. And there's good examples in Arizona that are already in place. I would point towards the Guadalupe partnership, actually with ASU. Dr. Megan Jean was able to reduce rates of cases in Guadalupe, declining from 5.5 times higher than the rest of Maricopa County average to being in line with the rest of the county. and she worked closely with the Pascua Yaqui tribal community in order to reach as many people as possible and also take into consideration cultural differences and ways of speaking with the community in respectful tones and coming from people who they would listen to instead of coming from outsiders. So that's the most important consideration, I would say, is to make sure that we're not imposing on these people, but rather working with them, always.
Another question posted to our group asked, how would we combat the mass misspreading of information in the media?
Combating misinformation can be extremely difficult, but we feel that the best way to do it is to keep an open line of communication with those who have questions. In addition to this, it's important to post educational content that both has reliable sources and tools that lay people can rely on to sift between what is and what is not reliable. That means that any information that's put out there needs to be understandable to the target audience and also needs to cite where it's getting its information from in ways that can be understood. Additionally, as previously discussed, all information should be culturally relevant, and information needs to be distributed in avenues that often aren't considered by the medical community. There has been a push in recent years towards advocating on things like social media and using the internet, but a lot of these programs are kind of in their infancy. And part of our program and part of our investment would be pairing with community organizations that already have a substantial online presence in order to properly spread this information. The community also asked about the recent change in policy from tracking cases to tracking hospitalizations. How does this affect monitoring cases in our model, since it seems like the cases are no longer being monitored much at all in the state?
So, tracking cases in the community and hospitals is important because it serves as a way for us to manage our resources and keep hospitals well run without being overcrowded. The more we monitor cases, the better knowledge we will have about the infectivity of COVID-19, and keeping up to date with cases help in maintaining infrastructure in the event that a new strain, more virulent, comes in the future. So this is just a way to prepare ourselves for the future.
Lastly, it was brought up multiple times in the community that there's a significant amount of irritation about COVID-19 around the globe and in the United States, and many people can hardly even stand to say the words anymore. With this being said, how do you keep the general public interested in spreading information?
Thank you so much for asking that. So, in order to make sure the public is still interested in our information, we are going to make sure that they understand the relevance of COVID. So, people who are infected over 2 years ago still have long-term conditions and they have no idea how long it will last. So, we don't know if there's still unknown conditions from it. We don't know if there's going to be new ones. They have to really listen to this information to understand how to deal with these. Additionally, COVID is a very convergent disease. It evolves very, very rapidly. So who knows if there will be a new mutation that causes another spike and more people to get infected. Also, we all have older family members, such as grandparents, parents, and we may have other people who are immunocompromised in our families. So this all relates to us all to try to reduce the spread because they would be much more impacted than we would. And lastly, the economy. The economy has not been the same since the pandemic hit. We have huge shortages of everything. Prices are going up like crazy. So this is really relevant in all of our days, all of our lives. So everyone should be interested in being able to learn more about it. Thank you for that question.